joining the webinar, which has been organized by the South Asia region. And today it is, our topic is on fortification. And it is mainly, I think we wanted to, this is a high time to look at the fortification. And these are the kind of all the experts and the and the topics that which has been really defined. I think you must have seen all these things. And in addition to that, I would like to remind you, and the South Asia region, each country, we have a IGN coordinator. And then whatever you have any kind of questions and any queries and things, you can always put your questions forward to your country coordinators. Dave, can you share the slide of the coordinators? Yeah, these are the country coordinators. So I think each country should really, I mean, you know, these big, prominent personalities in your countries. So you can always contact them for any kind of clarification or any support that you need. So over to you, Dave, to start the webinar.
Dear colleagues and friends, I wish you greetings from Ottawa in Canada. My name is Werner Schulting and I'm the director of the Iodine Global Network. I welcome you to this webinar on food fortification. Food fortification is a highly effective and cheap way to improve nutritional status of large populations. The impact of salt iodization or the fortification of grains with iron and folic acid or the fortification of oil with vitamin A has been scientifically proven and is beyond doubt. The impact goes beyond nutritional status. There is an impact on learning, there is an impact on work output, on morbidity, and even on mortality. This workshop focuses on monitoring, and in many cases one would think of the measurement of biological indicators. But for a fortification program to have impact after a launch or after it has been running, it is very important to monitor components of a program which make or break it. For example, is the food fortified up to standards? Is all imported food indeed fortified? Do control mechanisms exist and are rules enforced? And, for example, do the poorest utilize the food as well as the richer people? All of these things will determine the impact of the efforts of a food fortification program. So I hope that all of these things come up in your discussions, and I wish you a very good webinar. Thank you.
Thank you, Iodine Global Network, for this opportunity to speak today on the usefulness and rationale for fortification of commonly consumed foods. Thank you to Renuka as well for this opportunity. As we will be talking about particularly focusing on the monitoring aspects and what are the challenges that we face in terms of monitoring of the fortification programs, particularly large-scale fortification programs of staple foods. And then we will also be looking at the nuances of in each of the staples during the following presentations as well. So I have taken the liberty to basically talk broadly about the programming aspects in terms of why we should be focusing on fortification particularly, and also trying to put it in the context in the larger food systems narrative as well, and what could be the potential way forward, which basically will build into the subsequent presentations that are lined up for each of the individual staple fortification presentations as well, particularly in the region. So my focus particularly will be in the Asia region, since we are talking about this region per se. So I will focus my attention on the region. Okay. Slide is not moving. Can you see the next slide?
Yes, we can.
Okay, good. Yeah. So basically, the way I have divided the presentation is to give you a brief overview of the micronutrient deficiency situation globally, then talk a little bit about the region and what is the rationale for fortification, what are the common fortification vehicles, and what is the current status of fortification in the region. And then also look at fortification from the larger food systems perspective, because food systems also there's a lot of global discussions around food systems, and we have to look at fortification and other food-based interventions as well from a larger systems perspective as well. And particularly given the global crisis that we are facing, it becomes all the more important to look at things from a holistic perspective and a systems perspective, because it is impacting in ways which we have never thought about in the past as well. And then, of course, a way forward which potentially we can look at in terms of taking fortification to the next level. Yeah, so when you look at the global situation and, looking at the micronutrient situation, just as a precursor, World Food Program basically did a landscape analysis of the micronutrient situation, both in South Asia and Southeast Asia, and then also did a deep dive analysis of what the interventions are. So some of these data and findings are from the analysis which we did to basically understand what is the situation in the region in relation to micronutrient deficiency as well. So basically, I mean, more than 2 billion people are deficient in micronutrients, and anemia is a major problem, as you can see. And micronutrient deficiencies disproportionately affect people in the low and middle income countries, and particularly women and children. It's also important to understand that 50% of reduction in of anemia in women is the only SDG target related to micronutrient nutrition. And yet, since 2000, the reduction of anemia in women has been stagnant. And this is important to understand as well. So we have to basically look at how we can push the needle for us to basically attain the sustainable development goals as well. So, I mean, we are all aware of this. I wouldn't want to spend too much time on this particular slide. Basically, anemia is certainly a severe problem in South Asia, and also in Southeast Asia as well. The problem is significant. And now we will have to wait and see, immediately after the COVID, now with this Ukraine crisis, there is also analysis underway in terms of how that is going to impact on the overall micronutrient situation, not only in the region which is facing the conflict, but also in regions beyond, and particularly countries which are heavily dependent on food imports, and how that cycle will affect. And we are already seeing the impact of that in many regions across Asia as well. Now, given the situation that it is, when we did an analysis in terms of what are the main drivers of micronutrient deficiency, particularly in Asia. So now it's important to understand, and that also fits into the whole context of why fortification and why we should be looking at fortification also as a strategy to address micronutrient potent strategy, to address micronutrient deficiency, is that what has come about in terms of what the key drivers for micronutrient deficiencies are: unaffordability, market fluctuations, limited productions, lack of physical access, poor dietary choices. Then, of course, COVID-19 pandemic was an additional shock. And then, of course, which has not been mentioned over here, the whole Ukraine crisis as well will certainly have an impact on the overall micronutrient deficiencies as well. And of course, there are certain non-nutritional factors as well. Just on the right side to give a cursor in terms of what is the consumption pattern in terms of population unable to afford healthy diets, who do not meet the minimum dietary requirements as well, just to give you a flavor in terms of what exactly the situation is in the region. Now, given that particular situation, we have a whole host of interventions to address macronutrient deficiencies, and this has been widely talked about in WHO, the Lancet series, and UNICEF, and everybody we are talking about the potential interventions to address macronutrient deficiency, which includes, of course, supplementation, fortification, disease prevention and control, nutrition education as well, biofortification are some of the interventions, and also categorizing it into different target groups. You have on the right side the interventions, and of course, food fortification is also part of that interventions that we are looking at to address micronutrient deficiencies. Yeah. So, while there are a lot of whole host of programs as well, we have, certainly fortification is an important element of the overall strategy that we are looking at to address micronutrient deficiency, particularly among women of reproductive age and at the population level as well, when you look at the overall impact that it can have. And certainly here, I would like to place it on record as well, is that we are not, saying that, fortification is the silver bullet or it's the only strategy. There is a basket of interventions that we are talking about. Of course, ultimately the healthy, nutritious diet is the ultimate goal, where there is dietary diversity on the plate of the consumers who are consuming the food as well. So while there are many factors that will reach, which will lead to attaining that stage, which are probably not just necessarily limited to the individual choices or individual behavior in terms of what they consume, but also confounding factors like economic status, food availability, countries' economic situations, and global situations, climate change. So a whole host of factors will determine in terms of, and of course, cost as well. A whole host of factors will determine in terms of the choices that the consumers will make in terms of healthy diets as well. So we will have to look at a comprehensive approach where we don't lose out on strategies that will have an impact on the ground as well. And fortification certainly is one of those strategies that we should not be losing our focus on in terms of the population level approaches as well at the large level as well. So why food fortification per se? I mean, these factors probably are known to you as well, just to re-emphasize. It's a cost-effective strategy. We have studies to talk about that. The Copenhagen Consensus talks about it as well. And, one of the things which is probably, never discussed much as well is that the commonly consumed staples do not require, changes in dietary habits and behaviors as well. While we are talking about bringing about that behavior change towards healthy foods as well, when you operationally look at it on the ground as well, it is very difficult for somebody who's today consuming wheat flour to suddenly shift to rice, or somebody who's consuming rice to suddenly shift to something else as well. So changing people's behavior is a time-bound process. It takes a long time in terms of overall behavior change as well. And of course, as I mentioned, as education status, economic mobility increases, and that self-awareness comes in terms of having those diversified diets as well. That's a process which has its timelines as well. So we cannot be just waiting for that process to take its own course, but try to intervene and try to minimize the impact of micronutrient deficiencies through various interventions that are available. And for food fortification specifically is a very important intervention in that direction. And there's also seamless integration into the food systems and the food value chain as well. So now within the global talk about food systems and food value chain, fortification seamlessly integrates into the food systems as well. And we have seen that in examples of salt iodization, rice in certain cases, wheat flour, and oil, milk, and those kinds of staples as well. So that's also an important element when we talk about fortification, particularly from an operational perspective. Again, I would not want to delve into the overall effectiveness of these interventions. I mean, it's quite obvious from the slide as well on the impact. And then, of course, other speakers will also be talking about this, so I wouldn't spend much time on this. Commonly fortified foods, salt, wheat flour, maize is mostly in Africa. Rice, oil, milk, and other commodities are also fortified as well. Yeah. So, this, I want to spend a little bit of time over here in terms of, what is the current status of food fortification in Asia and Pacific. So when you particularly look at, and I've deliberately not put in individual country names in this particular buckets as well. So when you look at a range of where food fortification is operational and what is the status, you have, countries in different stages in this continuum. You have countries which are in pre-engagement phase, somewhere, the idea is being discussed and, they're trying to come up, okay, we want to do this and let's see how we go about this. In some cases, it is initial analysis has been done, the income buy-in has been attained, and they're moving towards, pilot phase or advancing implementation. And then some countries which have moved beyond pilot phase to optimization and making sure that, the entire social safety nets or whatever programming approaches that they have, it has been scaled up. And then, of course, you have the last bucket, which is fortified foods is widely available across the food system as well. But to mention the point is that we are not there in that last bucket yet. None of the countries are into those last buckets as well, as far as fortified foods being widely available across the food systems as well. And also, some countries might have made substantial progress on one particular staple, be it salt or say oil or say wheat flour, but not necessarily on a wide range of staples collectively as well. So that's why many countries, fit into different buckets as far as the continuum is concerned as well. And countries which have also, looked at mandatory implementation also have faced challenges in relation to supply chain and policies. And I'll come to that when I get into the whole food systems part of the whole discussion as well. So, yeah. So here, this is very important to look at, is that when we are talking about large-scale food fortification and from a systems perspective as well, and what basically leads to the success of fortification programming as well, despite having all the evidence and all the systems in place as well, it's important to have these components like the robust supply networks, efficient value chains, delivery platforms, be it public sector, social protection, safety net programs, or private sector channels. The consumers are also, of course, the main stakeholders here as well. Then there's an element of costing, which is very important in terms of the overall cost of fortification and how it helps deliver the product to the consumers at an optimal price. Quality assurance, food safety and quality, an important element. And overarching it is that, when you look at it from this food systems perspective also, we have to also keep this in mind, is that availability, affordability, and accessibility becomes an important element when it comes to fortified foods, being widely available and the consumers making those choices as well. And then, of course, governance structures are extremely critical in terms of, creating that enabling policy environment. Now, I'll give you an example of while there is a mandatory iron fortification law in the Philippines, it did not translate into action in the sense that, there was some policy gaps wherein the government allowed importation of rice, and there was no conditionality to attach to it in terms of that should be fortified as well. Now that led to a complete pricing imbalance between domestic production of rice and them mandating fortification of that rice, and then importation, which was not having that conditionality attached to it. And that basically led to price imbalance, and thereby inhibiting the program in terms of taking it to its optimal potential as well. So governance becomes very important, and looking at the whole policy framework also becomes very important when we are talking about fortification programs. And also the whole monitoring aspects which we are talking about and subsequent speakers will talk about, has to cover all these elements. When we are talking about, okay, these many people are fortifying, or these many consumers have been reached, but on all parameters of monitoring, on what has been mentioned in this particular slide, we will have to constantly monitor in terms of, okay, whether the supply networks are okay, whether the supply chain is efficient enough, whether delivery platforms are good enough or not. So these are important elements to keep in mind when we are monitoring and evaluating the programs, largely not just on the impact evaluation side, but also overall programmatic efficiency as well. Yeah, so the last slide in terms of, what is the potential way forward as well is that, consolidate whatever existing fortification programs are there. There are many in countries in operational where, through government programs to private sectors, fortified foods are being launched and pilots are being tried and products are being launched. Identify suitable markets and countries, look at, where there is maximum potential. Strengthen the regulatory framework for fortified foods. It's important because, if the private sector has to get invested and interested in this, without a proper regulatory framework, they will not, that predictability has to be there. Evidence generation, of course, being very strategic in terms of evidence generation. And there is a continuum when it comes to evidence as well. While we have evidence on, say, impact, acceptability, etc., we also need evidence on individual country-specific costing analysis, value chain optimization, how we can bring about technology innovations in the value chain to bring down the cost and improve efficiency, food safety, quality related aspects as well. So it's important to be very strategic when it comes to evidence generation as well. Evidence generation that the policymakers and the decision makers are keenly looking at, particularly if we want public financing of these fortification programs as well, and which seems to be the ultimate goal, looking at the global narrative when we're talking about scaling up fortification or large-scale fortification as well. Ultimately, our goal is that public financing has to come into the picture at some point so that it becomes a sustainable endeavor as well. So these aspects become extremely critical when it comes to that. So then again, of course, leveraging partnerships, nobody can do it alone. Public sector, private sector, civil society, academia, UN agencies, everybody has to join forces to take this to scale. Building in-country technical capacity. It's very important to have robust technical capacity in country among all the stakeholders that are responsible for fortification in countries as well. And that will lead to a sustainable endeavor in country as well. And of course, sustaining a systems approach, targeting all elements of programming within the larger food ecosystem as well, because that is how we will bring about the change, both in terms of making sure the overall target about making sure that the private sector is more interested, invested, and committed to ensuring healthy diets to consumers as well. Effective communication, advocacy, SPCC are also important elements in this entire process. And then, of course, moving towards mandatory environment for fortified foods. And I know there are two schools of thoughts over here in terms of, okay, fortification will work only in a mandatory environment. For sure. But if countries are not ready, what we can do in the interim to basically lead to that direction? I mean, can we prepare the infrastructure or the systems in place to basically make sure that those mandatory environments are highly successful? So, so that the steps that I have laid out over here to some extent, also act as a buffer to basically move towards that mandatory environment for fortified foods, which is the ideal state that we might look at. So let me stop here and thank you for your patient listening, and happy to answer any questions that you might have. Thank you.
No, so I work with Iodine Global Network as a consultant, and before I've worked with UNICEF for a long time, also with Global Alliance for Improved Nutrition, and yeah, I've worked on different fortification efforts and also on other nutrition programs. But I think what's more important is maybe this webinar, and thank for the organizers. It's very nice to talk to you, to the colleagues in South Asia again. We had a webinar some time ago on Fortimas, which I thought was very informative. So today is about monitoring, which is a topic that links to this, to Fortimas. But the key message I want to pass already is that we can spend a lot of time on a fortification program, but the amount of effort, if we do not know not just the scale of the program and the impact, but also how the different components are functioning. If we do not know that, then we can put the energy in the wrong place. So my message today is that we need to pay more attention to how well the program is functioning. And I give you some ideas from the salt iodization perspective. So there's some key questions regarding monitoring. And so what are the tools that program managers have to inform them about the program performance? And what are we measuring actually at the moment? And what do these data tell us? Or maybe more importantly, what do they not tell us? And are we measuring what we need for effective program monitoring? And what are some improvements that we can make? So let's first look at this chart, and I'm not going to talk about the meaning of it, but you have all seen this. This is the iodine status in the map of all the countries in the world and where the countries are. And many countries are doing quite well, which is great. And then the other data that we have is around the scale of salt iodization, the scale of your fortification program. This also shows that many countries have gone to scale. And with households consuming salt with any iodine. Now let's look a bit further at the South Asia region. Here you see the countries in the region with the latest data on the scale of the program, and the light purple bars are with the coverage of iodized salt of households with any iodine, and the darker colored one is with doses with have adequate iodine in the salt, and that's measured by titration and not using the rapid test kit. So this is one chart, and then the other chart is the iodine status, and it's according to WHO needs to be above 100, the median urinary iodine concentration, and you see that all the countries are doing quite well. And you think so far nothing is wrong, everything is hunky-dory, everything's going well. And when decision makers see this, they say, good, let's focus on other topics. Iodine is checked, we are doing well. But let's put the two graphs together because that is something that we don't do very often. We just look at iodine status or we look at program coverage, but to combine the data, I think is something we need to do more. So this is the data that we have, and what do we see? Well, we see, for example, a country like Bangladesh has an adequate iodine status, but 76% is using iodized salt, so 1/4 is not. The same for Afghanistan, where almost half of the population is not consuming iodized salt, while the iodine status at national level, the national average, is adequate. And the same for Pakistan, you could say that 1/5 of the population is not using iodized salt. And the other observation is that the adequacy of salt iodization is important, because that can mean that people do not get enough iodine. And as an example, India, 92% coverage, but 76% is only adequately iodized. So the main messages here is that Afghanistan, Bangladesh, and Pakistan have adequate iodine status, but a significant number of households don't use iodized salt. And some countries have significant challenges with the quality of salt iodization. And also with other fortification efforts, quality is often the main problem. So let's take this one step now further into a specific country, and I'm challenging you to guess which country this is, and you get 10 points for those that guess the country, and we'll give the answer later. So here you see a country that's 80% coverage with any iodized salt. So that means that 20% is not using iodized salt. What we don't know from this data is what percentage is using adequately iodized salt, and we don't know what percentage is using poorly iodized salt, right? So let's look a little bit further. As a program manager, you should then start to find out who are the users of non-iodized salts. Do we have subnational data? And what does it tell us? Can we see where the problems are? And do we monitor in those low use regions? The second point is which supply factors cause non-iodized and poorly iodized salts? So what monitoring data do we have from the supply side, from production or from imports? And is the monitoring tailored towards non-iodization and poor iodization? Because we want to know whether those supply factors are on our radar screen. Are we monitoring them? Do we collect any supply data or market data? Do we know who are the suppliers? Do we collect brand information? And does enforcement data exist and that we can use for monitoring purposes? And what does it tell us? And of course, then the next step is what causes these problems and what data do we need to answer this question? It's often not straightforward to look at, let's say, inadequately iodized salt. Is it the premix that's the problem? Is it the iodization practices that's the problem? Is it what happens after iodization where the problem is? We need to find out in order to come up with corrective actions. And which of those actions can improve iodization. If you focus on iodization practices, but the premix is the problem, then we focus our energy at the wrong point. And processed foods, of course, is a major contributor to iodine intake because of the salt that's iodized that's used in processed foods. And it can actually provide iodine in places where households don't use iodized salt. And of course, we need to monitor the implementation of the corrective action. If we do something, we want to know if it works. So as you guessed right, Pakistan was the country that I was talking about. And this is not to focus on you, but this is just to explain as an example. We see that the coverage is 80%, the iodine status is 123. And as we started to map the data, and that gives more information. And it really visualizes where the coverage problems are, which is in Balochistan and in NWFP and the other province, FATA. And then the iodine status, which is inadequate in 3 other provinces. And one of the overlapping provinces is FATA. So the mapping will help you to identify the subnational data. Go beyond the national averages is my message here. So this is a slide that I have used before. This from another country. We know the supply factor for fortification, of course, is the most critical to get a fortified food to the population. In this particular country, we saw that salt, and we have problems with salt that's not iodized, and salt that's poorly iodized, and it's because the cause that was identified is because of low awareness among the suppliers in the low use areas, and also with the low compliance, and also there was leakage of non-iodized salt and fraud into the salt supply sector. And the quality of iodization by small producers was identified as a main problem. We also found out that there was low awareness in the low use areas if you look at consumption sites. And in general, the monitoring in low use areas was inadequate. So what this information tells us is that we need to look at the current program and identify where the problems are and how do we measure that information. So going back to some of the key questions, what are the tools that program managers have to inform them about the program performance? It's mainly national survey data. In many countries, we observe that data on program inputs, on supply, enforcement, on the use of is limited and it's not systematic, they will give to your program. If you give them the data that the program is functioning well, then you get less attention for your program. And what are the improvements to be made on the monitoring side? We need tailored, light and flexible data collection tools to inform where the problems lie, and so that corrective action can be taken. Improvements need to be monitored as well to see the effect. And think of surveillance mechanisms, as explained in the Fortimas webinar. But also think of very ad hoc investigation tools. Can you collect information in the markets where the use of your fortified food is low? Can you look at official databases? Do they exist? Can you talk to key informants that know the sector very well and that can give you information? I think we need to use these tools more and where the corrective action can be taken. So in conclusion, we depend heavily on crude monitoring tools like surveys to give us direction in salt adaptation programs. And we see there's a tension between the purpose of monitoring for national status, for national data, versus what programs actually need in their design, in their implementation phase. The second point is that survey data on iodine status and household salt are rarely reviewed in combination with each other and often imply incorrectly that the iodine status is adequate, which leads to complacency. Routine monitoring exists often on paper, but is implemented poorly, not providing the program with the required information to improve performance. And we need to apply problem-based monitoring in order to develop corrective action. And there are tools out there, and you have many of those tools, and they're not sophisticated to develop the monitoring, which are less costly and more sustainable than national surveys. And also, it will give you much faster the information that you need. So let me stop here and thank you for your attention.
Thank you to the organizers for inviting me to join this webinar. I'll be speaking about rice fortification, what's known about its potential health impact, and challenges in monitoring health impact. Helena Pachon will be presenting after me. We'll be presenting many health impact monitoring challenges that are also relevant to the monitoring and evaluation of any food, including rice. So for that reason, I'm going to focus on a few issues that are very specific to rice at the end of this presentation. First, a quick background. As of 2022, there were 8 countries globally with legislation mandating rice fortification. These countries are Costa Rica, Nicaragua, Panama, Papua New Guinea, Peru, the Philippines, Solomon Islands, and the United States of America. You'll note that on this map, most of the world is gray for unknown for rice fortification status. The Global Fortification Data Exchange, which collates this data, is pretty conservative about classifying countries and requires a confirmed no response from a local stakeholder before classifying a country as no fortification. Currently, the go-to reference for understanding whether rice fortification produces a health impact is a 2019 Cochrane review on the fortification of rice with vitamins and minerals for addressing micronutrient malnutrition. The Cochrane Review's results were used to inform the 2018 WHO guideline on rice fortification. Although the conclusions of the Cochrane Review were fairly limited and narrow given the available literature, the guideline borrowed heavily from lessons learned from wheat and maize flour fortification to consider whether rice fortification is an appropriate public health strategy to improve micronutrient intake. The 2019 review's results ended up being limited to only randomized controlled trials. Even though other study designs were eligible for inclusion, the study team either did not find studies using other study designs, or these studies were eliminated for other reasons. The outcomes across the 17 included studies were anemia prevalence, hemoglobin levels, iron deficiency, vitamin A deficiency, folate status, adverse effects, and diarrhea. I'd also like to note that this list of assessed outcomes is fairly limited considering that many studies of fortified rice typically include several micronutrients, including B12, B6, zinc, thiamine, and niacin. But although the nutrients were also delivered in the fortified rice, they were not evaluated by the study authors. I'd like to go over the key outcomes included in the review's grade table. First was anemia, which the review included 7 studies, but found minimal to no effect on anemia prevalence. However, it's important to keep in mind that anemia has multiple etiologies, and these studies were conducted in a range of geographies. If the anemia present in a country is not nutritional anemia, then a dietary intervention is not going to affect the anemia prevalence. Another consideration is that rice fortification must use a lower bioavailable iron compound because more bioavailable iron compounds, such as ferrous sulfate, can discolor the rice. The flours, which have an advantage in terms of dilution and color, are able to use higher bioavailable iron compounds in fortification and avoid this issue. If we look at hemoglobin concentrations, there's better indication that hemoglobin does improve after rice fortification. However, we have the same considerations here as we did with anemia. The effect would be dampened if anemia is due to other issues, such as infectious diseases. The review found a reduced risk of iron deficiency. However, because rice fortification is a relatively newer food vehicle, there is still ongoing research to improve how rice fortification is conducted. So much of the past research around rice fortification does not incorporate newer knowledge about iron fortification of rice, including improved bioavailability through micronization of the iron compound or the inclusion of a chelating enhancer. This would also result in an underestimation of the potential impact on iron deficiency. The results for vitamin A deficiency were inconclusive. It's important to note here that there were only 4 studies included. There also may be a question of how well the vitamin A was retained in the final food, since there are inconsistent findings around the retention of vitamin A in rice over its supply chain, from production to storage to cooking. Only one study included folate status, and it did find an improvement in folate concentrations. Unlike iron and vitamin A, which are more complicated nutrients to assess and interpret, it's fairly consistent to see a positive increase in blood folate after fortification with folic acid. However, because it's only one study, it's difficult to make conclusions around the magnitude of increase. In terms of adverse outcomes, the only one found in the literature was an increased risk of hookworm infection. Again, we here only have one study as reference, and we need to interpret this outcome carefully. If hookworm infections are indeed higher in individuals who have improved nutrition status after consuming a fortified food, it doesn't mean that we shouldn't improve nutrition, but it means that perhaps complementary interventions in infection prevention and control should be delivered alongside nutrition interventions. For diarrhea, again, we only have one study to consider, and given the very large confidence interval, the Cochrane review concluded that there is an uncertain effect of fortified rice on diarrhea. Next, I'll be speaking on a few of the health impact monitoring issues that affect rice specifically. I want to point out here that I'm not speaking of health impact in controlled trials, but specifically monitoring health impact in programs under real-life situations. As I mentioned earlier, the next speaker will go into more detail regarding general health impact monitoring challenges, which are relevant for many foods, including rice. As you remember, there are only 8 countries with mandatory fortification legislation, so there are not a lot of countries to begin with where there is an opportunity to monitor the health impact of rice fortification. One of the challenges in monitoring health impact is simply a lack of planning to monitor at all. Of course, there are many reasons why a country may not plan to monitor health impact, such as lack of resources. Of those 8 countries, only 2, Costa Rica and the United States, have conducted any health impact evaluation of their fortification program where rice fortification is included. In some countries, such as the Philippines, fortification was passed over 50 years ago, and there was no baseline information collected to inform an evaluation. And without baseline information, it's very difficult or impossible to interpret changes in health status after fortification. Not only are the number of countries that have evaluated rice fortification limited, but folate is the only nutrient that has been evaluated in both Costa Rica and the US. Results were very consistent across both countries. Both saw significant improvements to blood folate status, reductions in folate deficiency, and reductions in neural tube defect rates after fortification. So a challenge so far with rice fortification is that although it's often used to add multiple micronutrients, only a very limited number of nutrients are assessed for health impact. The health impacts I mentioned from Costa Rica and the United States carry a very large caveat, however. In neither one of these countries can we attribute the health impact to rice fortification alone, because both of these countries fortify wheat and maize flour with folic acid and implemented all 3 cereal grains at the same time. In fact, of the 8 countries with rice fortification legislation, 7 of these countries also have mandatory fortification for flour. In many cases, the same nutrients are added to the flours as well as rice. With dietary data and subnational data, it can be potentially possible to specify or narrow down the contribution from rice. However, this data is often not available in countries, or more complicated analyses have not been carried out to understand the contribution of rice fortification specifically. In summary, one of the key challenges in rice fortification is that it's not as widely implemented as flour or salt fortification, so there are fewer opportunities to evaluate health impact in both research studies as well as program evaluations. Another challenge, although not rice-specific, is that anemia and hemoglobin are often used as proxies for iron status, which may not be appropriate in certain contexts. And on the flip side, there are several nutrients that are commonly added to rice which aren't measured at all. In the limited number of countries that have carried out post-fortification evaluations, efforts have not been made to specifically understand rice fortification's contribution to health impact. Given the concurrent fortification of multiple foods alongside rice, it's then hard for systematic review efforts to include evaluations or observational studies from fortification programs because they can't tease out the effect of rice fortification alone. Finally, despite these challenges, one of the key advantages that rice fortification has is that it's following decades of experience in flour fortification, and the successes of flour fortification are largely expected to translate also to rice. As a result, despite the lack of rice-specific literature across outcomes and nutrients, rice fortification is expected to be as effective an opportunity as flour fortification to improve health outcomes. Thank you for your attention. If you have any questions, please feel free to email me at the email address here. Thank you again to the organizers for all their work in putting this webinar together. Have a great afternoon.
name is Elena Pachon. I would like to thank the webinar organizers, and in particular Dr. Renuka, for inviting the Food Fortification Initiative to present on wheat flour fortification. I'm going to start and finish with the main messages I hope you get from this presentation. 90 countries mandate wheat flour fortification with a diversity of nutrients. Wheat flour fortification improves nutritional status and other health outcomes associated with 4 of these nutrients. Measuring the impact of food fortification programs presents many challenges which can be overcome. Currently, there are 90 countries with mandatory wheat flour fortification, those shown in green. These countries require that 1 or more of the nutrients listed at the bottom of the slide be added to the flour. Interestingly, there are only data on the effectiveness of 4 of these nutrients, as we'll see later on. In this presentation, I'm going to answer the question, does wheat flour fortification have a health impact? I'm going to present evidence from effectiveness studies, which are studies undertaken in real-life conditions when food fortification is implemented at large scale after mandatory legislation. I'm going to begin by sharing studies that were completed after a country implemented mandatory wheat flour fortification. These results are in a book chapter that I wrote, which was published last year. You can download a free copy of the chapter at the link found at the bottom of this slide. The studies that I reviewed included 1 or more biomarkers of folate status or functional outcomes of folate status. In the second column, we find biomarkers of folate status, such as the prevalence of folate deficiency. And in the third column, we find functional outcomes of folate status, such as the prevalence of anemia. For iron, zinc, and vitamin B12, the studies included fewer biomarkers and functional outcomes, as noted in this table. The last row has hemoglobin and anemia. These can be influenced by multiple nutrients. I reviewed many study types, those conducted in single countries that assessed outcomes before and after fortification, either in the same or different individuals, trend studies that assessed outcomes multiple times after fortification initiation, cross-sectional studies that assessed outcomes and fortification exposure at the same time, and cost-effectiveness studies. Additionally, I reviewed cross-sectional studies that assessed outcomes only in the post-fortification period, studies that modeled the impact of wheat flour fortification in single or multiple countries, and systematic reviews and meta-analyses of multiple studies from multiple countries. I'm going to start by showing the results from flour fortification with folic acid. In all of these slides, a green color means the outcome improved after fortification, such as an increase in serum folate or a decrease in folate deficiency prevalence. A yellow color means that the outcome got worse after fortification, such as a decrease in serum folate levels or an increase in folate deficiency prevalence. And a blue color means that the study reported neither an improvement nor a worsening of outcomes after fortification. In 40 studies that assessed folate status or deficiency, more than 85% of them found an improvement after fortification. 13% showed no difference after fortification, and 1 study from Uzbekistan showed a worsening after fortification. Specifically, the prevalence of folate deficiency was higher in households possessing flour that should be fortified. 60 studies reported neural tube defect outcomes. The results from 47 of them are shown in the bar that has the red arrow. Overall, 88% of these studies showed a reduction in neural tube defects after flour fortification with folic acid. 26 studies reported on cancer outcomes. 50% of the studies reported an improvement in the cancer outcome after fortification with folic acid. 31% showed no difference, and 19% reported a worsening of the cancer outcome. In trying to reconcile these conflicting results, we see 2 trends. One is that studies published in the 2000s tend to show a worsening of outcomes, while the opposite is observed in studies published in the 2010s. And 2, worse outcomes are observed in studies with sample sizes less than 2,000 individuals, while studies that observe no difference or a decreased cancer incidence after fortification have sample sizes greater than 2,000 and going into the millions. An example of a study that made no difference for many types of cancer was a meta-analysis of meta-analyses that had 27 million data points. 96% showed no relationship or a protective relationship between high folate intake and cancer, while 4% showed a harmful relationship between high folate intake and cancer. Here we have another 17 outcomes reported in 26 studies. The outcomes are listed across the horizontal axis, starting with folate deficiency anemia on the left and ending with non-syndromic cleft palate on the right. 90% of the studies showed an improvement or no difference after fortification with folic acid. Let me explain the studies that showed a worsening after fortification with folic acid. For one study, higher homocysteine levels were reported in the post-fortification period. This is the opposite of what is expected. When folate levels are adequate, homocysteine levels are usually low. The authors suggest that in adolescence, there is a trend towards an increase in homocysteine levels, which was not affected by fortification. The second study was a modeling exercise where the researchers assumed that fortification with folic acid would mask vitamin B12 deficiency. 30 studies reported hemoglobin or anemia prevalence. 47% of these showed an improvement, 17% showed a worsening, and 37% showed no difference after fortification with one or multiple nutrients. There are 4 potential reasons for these conflicting results. One is the presence of non-nutritional causes of anemia in the population, which cannot be addressed by fortification. 2 is that nutritional causes of anemia were not addressed by fortification because the wrong mix of nutrients were added to the flour. 3, levels of nutrients or compounds used in fortification did not follow international guidelines. And 4, that fortification compliance was low. 8 different outcomes of iron status were measured after flour fortification with iron. Overall, most showed an improvement. The exception was iron deficiency anemia, where some studies showed no effect, and one found an increase in the prevalence of iron deficiency anemia after fortification. There are few studies that reported on vitamin B12 outcomes. They all showed an improvement after flour fortification with vitamin B12. Similarly, there are few studies that reported on zinc outcomes, and they all showed an improvement after flour fortification with zinc. In summary, folic acid was the most studied nutrient in effectiveness studies, and the most studied outcomes were neural tube defects, cancer, folate status, folate deficiency, anemia, iron deficiency, iron status, hemoglobin, and iron deficiency anemia. For all of these outcomes except iron deficiency anemia, the majority of studies showed improvements after fortification. For some of the outcomes, specifically cancer, anemia, hemoglobin, and folate deficiency, there were studies that indicated health outcomes worsened after fortification. Excuse me. The discrepant results for cancer may be due to years since fortification initiated and sample size differences. The discrepancy in hemoglobin and anemia results may be due to non-nutritional anemia that cannot be addressed by fortification, nutritional causes not addressed by the right mix of nutrients added through fortification, fortification levels or compounds that do not follow international guidelines, or poor fortification compliance. The preponderance of the evidence suggests that wheat flour fortification improves many health outcomes. However, because fortification may also be associated with negative health outcomes such as cancer, health monitoring should continue to assess these outcomes in countries with fortification. I want to allay any concerns you may have about cancer with trend data from the United States, where wheat flour has been fortified for decades. Here we have 2 graphs with the rate of colorectal cancer per 100,000 population in the United States. As you can see in the horizontal axis, the year of cancer diagnosis ranges from 1975 to 2015. Around this period, voluntary fortification of breakfast cereals with folic acid began in 1973, and mandatory fortification of grains with folic acid became effective in 1998. The left-hand side has the data for males, and the right-hand side has the data for females. For both women and men, the dark blue line shows a reduction in the number diagnosed with colorectal cancer during this period. There is no evidence that fortification with folic acid increases the number of people being diagnosed with colorectal cancer in the United States. Researchers reviewed data on the annual mortality in the United States from colorectal cancer from 1950 to 2010, which is the timeline that appears along the horizontal axis. They note in the dashed vertical lines that voluntary fortification of breakfast cereals with folic acid began in 1973, and that mandatory flour fortification with folic acid became effective in 1998. The data are presented for men in red and women in blue. For both women and men, there was a decrease in annual deaths from colorectal cancer over the 60-year period. These data suggest that folic acid fortification does not increase deaths from colorectal cancer in the United States. Moving on to the second objective of this presentation, there are several challenges with measuring impact in food fortification programs through effectiveness studies like the ones I just reviewed. I will mention a few of these challenges and potential solutions to overcome them. As of September 2009, all wheat flour used for making bread in Australia had to be fortified with folic acid. Because large-scale fortification is often implemented under a national mandate, it rarely offers an opportunity to have a randomly selected control group that does not get fortification for a period of time. The lack of such a group makes it difficult to infer causality for fortification. Thus, we cannot answer with certainty, does fortification cause an improvement in a health outcome? For example, these are data from 2 national nutrition surveys conducted in Costa Rica in 1996 in red and in 2008 in green. Between 1996 and 2008, maize flour and milk were mandated to be fortified with iron, and the iron compound used to fortify wheat flour was changed to a more bioavailable fortificant. Therefore, researchers used the national surveys to evaluate if there were changes in iron-related biological markers in children 1 to 7 years of age. We can see in the graph that there was a reduction in the prevalence of iron deficiency, anemia, and iron deficiency anemia in children between 1996 and 2008. Is it plausible that fortification contributed to the impact observed? Here we have the program impact pathway followed by the researchers. They assess various factors in Costa Rica's food fortification program. First, they assessed whether there was a potential to benefit from fortification. They concluded there was because micronutrient deficiencies were present. As we saw on the previous slide, iron deficiency was 27% in children. Next, they assessed if fortification policy had been created and legislation passed. The answer was yes. Next, they assessed if bioavailable fortificants were mandated. The answer was yes, as I mentioned in the previous slide. Next, they assessed if foods were fortified at mandated levels. They obtained data from the government regulatory agency that confirmed that 246 wheat flour samples obtained in bakeries over a 1-year period all met or exceeded the iron content required by law. Next, they assessed if fortified foods were consumed in adequate amounts. They analyzed dietary data and estimated that fortified foods contributed 49% of children's dietary iron requirement. And as we saw in the previous slide, they assessed the public health impact and saw a reduction in micronutrient deficiencies. This combination leads us to believe that it is plausible that food fortification with iron in Costa Rica contributed to the health impacts observed. This type of complementary information can be gathered for any program to argue for fortification's contribution to health impacts. Wheat flour fortification was mandated in 1951 in Chile. The iron compound was changed to a more bioavailable type in 1965. However, the country did not assess anemia at national level for the first time until 1974. This presents a problem common to many countries that have been fortifying for a long time. They were not able to get a baseline survey before fortification started. For those countries that have not yet started mandatory fortification, the obvious solution to this challenge is to plan for an evaluation from the outset. This requires dialoguing with stakeholders, fundraising for, and executing a baseline survey prior to fortification initiation. Additionally, if a country is not able to get a baseline survey, there are other study designs that can be used to assess the contribution of fortification to impact. Here's an example from Oman, where a national micronutrient status and fortified food coverage survey was conducted in 2004. This was a one-time cross-sectional survey after fortification had been mandated. Ferritin and C-reactive protein were assessed in non-pregnant women of childbearing age. This information was used to calculate the percentage of women with iron deficiency. Families were asked how much wheat flour they consumed in the previous 2 months and the total number of individuals living or working in the household during this time. Also, wheat flour samples were taken from homes and analyzed for the presence of fortificant iron. This information was used to calculate the monthly per capita consumption of fortified wheat flour. The researchers then completed a dose-response analysis and found that the prevalence of iron deficiency was lowest in women whose households consumed the highest amount of fortified wheat flour, 26.8% compared with 38.8%. These results are in the direction we would expect if flour fortified with iron is being produced and consumed in the country. While the study design does not allow us to conclude that fortification caused a reduction in iron deficiency, the results suggest that fortification is contributing to improving the iron status of women in Oman. Another challenge is that impact evaluation surveys can be costly. In June 2004, wheat and maize flour fortification with iron and folic acid became mandatory in Brazil. Researchers based in the city of Recife were interested in determining if the fortification mandate had an impact on the number of babies born with neural tube defects. The country has a national information system on live births. The information in this system was used to determine if a child was born in Recife with a neural tube defect. The researchers then counted the number of babies born with neural tube defects before and after fortification became mandatory. This research project did not require primary data collection by the researchers. They were able to use existing data to assess if fortification had an impact. This and the studies from Costa Rica and Oman are a lesson for us. We can use existing data, such as national nutrition surveys and live births registries, to estimate the impact of food fortification. For the 2014 Demographic and Health Survey conducted in Cambodia, decision makers added a micronutrient module for the first time. This allowed for nationally representative information to be available for several biological markers of nutrient status: iron, vitamin A, vitamin D, calcium, folate, vitamin B12, and iodine. This is an example of adding fortification-relevant questions to existing data collection systems. The resources required to add biological sampling to existing surveys such as this one are substantially lower than paying for a survey to exclusively measure the impact of food fortification. In summary, measuring the impact of food fortification programs through effectiveness studies presents many challenges. Some of these challenges can be overcome by gathering complementary information, which allows assessing the plausibility that fortification contributed to health outcomes, planning for impact evaluation surveys while planning for fortification implementation overall, employing non-traditional impact evaluation study designs, and using existing data and data collection systems to reduce costs. In conclusion, 90 countries mandate wheat flour fortification with a diversity of nutrients. Wheat flour fortification improves nutritional status and other health outcomes associated with 4 of these nutrients. And measuring the impact of food fortification programs presents many challenges which can be overcome. I would be happy to receive any questions or comments you have through my email address listed here. Thank you.
Day, and good afternoon to our participants and colleagues. Firstly, thank you very much for inviting me to this webinar to present on some of the benefits of food fortification and the issues of poor monitoring. A lot of the information on food fortification and monitoring have been presented before this, but in the next 10, 12 to 14 minutes, I will be talking about the benefits and at the same time highlighting some of the issues of poor monitoring which impede the fortification programs. My presentation does not mean that fortification is not an answer. It can be a very important tool in a group of interventions which would be able to support micronutrient deficiency reduction. However, there are many issues of fortification monitoring which impact and impede this successful programs. So
Dr. Angela, sorry, the line is a bit faint. Can you check that audio setting again?
Yeah, can you hear me
much
now?
Better, much
Is
better.
that better? Okay.
Yes, please continue like this.
Okay. So if you look at micronutrient status in Southeast Asia countries, deficiencies exist across all countries. However, the improved socioeconomic status, access to food, and increased coverage of health and nutrition interventions have improved micronutrient status, while of course there are lots of subnational disparities and country disparities. If you look at the evidence from the recent national micronutrient surveys, such as the Nepal Micronutrient Survey, India's Comprehensive National Nutrition Survey, we can see that there has been improvement in micronutrient status. At the same time, there has been a survey done in National Survey in Myanmar, ongoing survey data analysis in Bangladesh, and also I think in Sri Lanka, there's going to be a planned national micronutrient survey, which would give us a better picture of the micronutrient status. However, one thing that we must keep in mind is that the pandemic and the other global issues and the global economic downturn may have negative impacts on micronutrients as well as nutrition status overall. A good example is the COVID-19 pandemic, and this is of course estimates that there has been a 45% reduction in IFA supplementation in adolescent girls globally. This was published in the World SOFI, the Status of Food Security and Nutrition report last year. And this is just one example of the kind of disruption to programs caused by the COVID pandemic.
Dr. Angela, sorry again, the volume dropped.
Is it clearer now? Is that better?
Not as good as before.
Okay, let me see. Let me just put on my headphones. That may help, I guess.
Yeah, it was fine earlier, but then it dropped.
Yeah, can you hear me now?
Perfect. Please
all
continue.
Right. Okay. So if you look at fortification, we all know that it's one of the main interventions for preventing and controlling micronutrient malnutrition as part of a package of complementary interventions. It aims to improve dietary diversity, and also it requires less behavior change in consumers. So this makes it quite advantageous as opposed to other actions such as supplementation. Also in cases where dietary diversity is difficult, consumer behaviors and consumer purchasing power is low, fortification has a good approach. Fortification is a good approach. Of course, though, nutrition education, social marketing, and behavior change communications are still very, very important, even through fortification programs. There's a lot of large-scale fortification of staples going on in Southeast Asia, but there are huge gaps in monitoring, evidence of program effectiveness, and other data gaps, and a lot of coordination gaps. And these hinder the micronutrient delivery programs of through fortification, unfortunately. Now, if you look at some of the successes in food fortification, obviously the salt iodization program is possibly or definitely the most successful program with a huge coverage globally. If you look at South Asia region, according to the percentage of households consuming any salt with iodine, 89% of South Asia is covered. However, this is on any salt, so it may be any salt with iodine, so it may not be up to the level that is needed. There may be regional disparities, but salt iodization is very, very successful. However, if we look into the program, there are some issues, such as only 89 of the 145 countries with legislation on salt iodization have recent data on population coverage, according to the UNICEF data. There's also a lot of discussion on it may be anecdotal or documented case studies on iodine excess. And this could very often undermine a government's commitment to salt iodization programs. Therefore, adequate monitoring and coordination is vital. And if this doesn't happen, the iodization program can be in jeopardy. The other issue, of course, which is commonly discussed nowadays is the fact that there's a reduction of population salt intake promotion to reduce hypertension from the NCD colleagues and NCD perspective. Though salt reduction is compatible with iodization, it requires a lot of diligent monitoring, regular monitoring, coordination between different sectors like the salt iodization program, the health sector, the regular data generation. And if this doesn't happen, again, the salt iodization program could be in jeopardy. If you take folic acid fortification, we know that improved folate and homocysteine levels are correlated with reduced neural tube defects. But many countries do not fortify. Issues of cost, concerns of long-term adverse effects, epigenetic changes, unmetabolized folic acid, and the masking of vitamin B12 deficiency by folic acid fortification are some of the reasons why countries are reluctant to fortify. Unfortunately, again, monitoring would play a much stronger role. If there's a good, strong monitoring across in many of all the countries that are fortifying folic acid, this question may not arise. As an example, a recent review in 2020 by Murphy showed a weak correlation in NTD prevalence, neural tube prevalence, and folic acid fortification, irrespective of the cereal grain fortified. There was a stronger correlation when this data was stratified between improved socioeconomic status and reduced NCDs. There was a very strong linear relationship. So this kind of evidence or information that comes out impacts fortification programs. So therefore, continuous monitoring and evaluation is critical. There has to be good regulatory oversight of fortification, surveillance of neural tube defects in the case of folic acid, population surveys. Unfortunately, the capacity of low middle income countries to do all this is somewhat limited, and that is an issue that needs to be addressed. If you take iron fortification, this is probably one of the biggest issues that face iron deficiency or anemia is one of the biggest or the major public health problems faced in our region. The high prevalence of iron deficiency anemia, not only globally, and the poor rates of improvement have helped to promote iron fortification of staples in this region as well as other regions. And there's very clear effectiveness for wheat flour fortification, where the iron deficiency is the main etiological factor of anemia. So many governments in this part of the region have also gone ahead with fortification under the impression that anemia rates will improve. But what happens is, if you look at Southeast Asian countries, only about 40 to 45% of the anemia is attributable to iron deficiency. Therefore, fortification is possibly less effective in reducing anemia in these countries as opposed to some other countries. And this has been an issue which has dogged the fortification program of iron fortification program. If we look at the guidance provided by WHO, it very clearly recommends fortification of rice with iron, fortification of wheat with iron. If you look at the evidence though the recommendation is strong, there's very low certainty of evidence for many of these. And that is again due to some of the issues that were raised by the previous speaker. So I will not go into those in detail, but WHO recognizes that fortification, vitamin and mineral fortification, is a very important strategy in the reduction of micronutrient deficiencies. The recent systematic review, again referred to by the previous speaker in 2019, showed that wheat flour fortification will reduce or may reduce anemia in populations over 2 years of age. But again, effects on iron deficiency and hemoglobin were uncertain. And iron fortified wheat flour in combination with other micronutrients probably reduces iron deficiency. However, for rice fortification, the latest Cochrane review shows a different picture. It shows that fortification of rice with iron alone and in combination with other micronutrients may make little or no difference to the risk of anemia or presenting iron deficiency or vitamin A deficiency or on the serum folate. So this kind of, this is all because of the lack of evidence, lack of monitoring, and the lack of impact assessments, and these jeopardize the rice fortification program. There's much new data coming out now, and there's a lot of learning to be done with rice fortification, as mentioned by the previous speakers, where the type of the bioavailability is low, therefore those issues need to be addressed. So before proceeding on any new fortification programs in a country, it is good if more effective fortificants and improved coverage can be explored, and very much more improved monitoring of the existing fortification of staples are implemented in order to generate evidence on effectiveness and impact. Now, programs are very often, especially in this part of the world, practically, programs are very often started with incomplete information, no baseline micronutrient surveys based on experience in other countries. And again, I must emphasize, very often governments do this in the hope that anemia prevalence will reduce. And when the anemia prevalence does not reduce, that impacts the program and the sustainability of the program. So monitoring is again very, very essential, even though the program may have started with incomplete information. Now, what are the information needed before you start fortification? I know this is not exactly monitoring, but of course it is part of the data that needs to be collected. So pre-implementation, a situation analysis is essential, evidence-based selection of fortificants and the appropriate vehicles, data on population dietary patterns and intake is vital. The adequacy of population data to inform which target groups should be which target groups will benefit from the fortification, assessment of the coexisting micronutrient delivery systems and how much of the micronutrient would be delivered through all these systems is very important. And there has to be absolute clarity on the outcomes expected when deciding on fortification. If your anemia in the country is mostly attributable, okay, only 45% is attributable to iron deficiency, then you cannot expect 100% improvement in anemia. And that has to be very clearly discussed and decided before going into fortification. And before the fortification occurs, or even is sort of planned, the planning of fortification monitoring is absolutely essential. And then, of course, post-implementation, you need data on the monitoring, which includes on biomarkers, adverse effects, other outcomes, data on the delivery systems, compliance, consumption of the product that is fortified, data on behavior change, and information on mitigating actions in response to monitoring data. This also very often does not happen. So if these are in place, then there is always information, solid information on which a country can decide on further actions. Recently, so in 2006, WHO published a document which contains a monitoring and evaluation system, which proposes a monitoring and evaluation system for food fortification. And it's still valid in this day, where there are certain steps at which regulatory monitoring has to occur and certain steps at which household and individual monitoring and evaluation needs to occur. So if you look at the household and individual monitoring, the provision of the fortificant, the utilization, the coverage, and then assessment of impact on consumption, the biochemical parameters, clinical functional outcomes need to be assessed. The importance of monitoring of fortification is also highlighted by a very recent manual that's published by WHO, which is a manual for millers, regulators, and program managers on monitoring flour fortification to maximize health benefits. Now, this document was published in 2021, and it very clearly lays out 6 or 7 steps in very much detail, a lot of detail about how to fortify, what are the steps, what are the issues and barriers. Now, this is particularly targeted at flour fortification, but some of the general principles can be very easily applied to rice fortification as well. Now, before I end my discussion, I want to bring up another point where monitoring is so vital for fortification. So monitoring is vital for ensuring the safety of fortification and preventing possible excess intakes of micronutrients. If we take a pregnant woman or a child or a woman of reproductive age in many of the countries in our region, and you map out what are the micronutrient delivery systems that are bringing micronutrients into her body, there are so many, and sometimes this is very concerning. So if you take, say, a pregnant woman, there may be a large-scale staple food fortification program that's bringing in micronutrients. Then, of course, the ministries of health usually have a IFA supplementation or a multiple micronutrient program, which also supplies supplements. Then she may be a recipient of Social Security and Support Scheme and supplementary foods, which may also be very often supplementary foods, especially the commercial supplementary foods, are very often fortified with micronutrients. Then some of these women also go out to maybe a general practitioner or a separate private practitioner who will definitely prescribe multivitamins or a micronutrient, which also will be purchased and consumed. Then there are commercially fortified foods in the market, breakfast cereal or wheat flour or whatever, which if she purchases and consumes, that will also add micronutrients. Then for younger, if you take the school-based group, you get the school fortified foods, IFA supplementation for the adolescent girls. Again, they may be, so if you look at one single individual, there may be so many ways in which they receive micronutrient supplements and micronutrients as fortificants, supplements, food, and so on. So this is a huge concern for safety, and therefore
monitoring is vital to ensure the safety of these programs. In 2017 or 18, WHO had a technical consultation on the risk of excessive intakes of vitamins and minerals through public health interventions. The current practices, and there were some case studies presented, include, and these were all published in the Annals of the New York Academy of Sciences. One of the presentation papers I have highlighted is by Dr. Renuka, who looked at supplementation of micronutrients in children and food fortification initiatives, and assessed to see how much of those initiatives resulted in children's tolerable upper levels being reached, especially for vitamin A, and I think it was iron. So like that, there were several papers and research studies which seem to indicate that, especially in the Latin American countries, the tolerable upper limits, especially for vitamin A and iron, were at almost threshold levels for safety. So this is another issue which makes it vital that monitoring of such programs are important at every step of the way. And not only monitoring, but also collaboration and coordination across different sectors, because multiple ministries, agencies are pumping in micronutrients into these children or adults or pregnant women. And we do not know, very often the coverage may not be perfect for some, say, a supplementation program, and therefore the mother or the child may not be getting that much of micronutrients, but we don't know that. And that is why we need to assess, monitor, evaluate the appropriate biomarkers, impact assessments, and adverse events, so that we can safely fortify foods, safely deliver fortificants through micronutrient food systems, but yet be conscious and also reap the advantages of micronutrient fortification without the risk of excessive intakes and other adverse effects. So in summary, the evidence for impact of micronutrient fortification is equivocal. There is evidence for fortification, and there's also evidence that shows that fortification is not as impactful. And this, as I said right at the beginning, may be because of the quality of data and monitoring rather than actual impact. However, for iodine, it's very clear, there are no doubts that iodine has had a huge impact. The poor quality data obviously will hinder the fortification program and their sustainability. And this is something that we really need to focus on. Therefore, active and consistent monitoring of nutrition status associated with fortified food is absolutely essential to any fortification program. And I must emphasize again, before the fortification program even starts, the monitoring also must be built in, planned and built into the program. And assessing and ensuring multi-sector coordination between the different entities that run these micronutrient delivery systems is very, very important. Now, finally, preventing and managing micronutrient malnutrition needs a context specific. So country A may be different to country B and may need a separate analysis and a separate set of interventions. So it has to be context specific, pragmatic, and a combination approach, which includes socioeconomic upliftment, a varied diet, water and sanitation, supplementation, and fortification. And these have to be based on the country context. I will stop there and thank you for your listening, and I'm available to answer any questions. Thank you.
Good afternoon, colleagues. My name is Zibai Murira from the UNICEF Regional Office for South Asia. I'm based in Kathmandu, Nepal, and I support regional efforts to improve nutrition of women, children, and adolescents. It is a great pleasure to be with you all today, and thank you to the IGN colleagues for this opportunity to join you in conversation. Insufficient progress in resolving maternal and child malnutrition in South Asia is hampering the region's attempt to accelerate human capital formation. Micronutrient deficiencies remain widespread and a key challenge in the region. Key nutrients such as iron, zinc, folate, vitamin A, and the B vitamins are lacking in the diets of vulnerable groups such as young children. The poor quality of children's diets is the single most important driver of child malnutrition in all its forms in the region. The overlapping crisis, the lingering impacts of COVID-19 pandemic, climate change, food crisis, and the rising food prices are all increasing nutritional vulnerability of women and children to malnutrition. Therefore, it is important to protect the gains that we've made in the past 2 decades. And secondly, it's important to accelerate progress towards the SDG targets for nutrition in this changing and challenging context. With the right actions, we can fill nutrient gaps in the region. And large-scale food fortification is one of the most cost-effective proven actions. It improves diet quality across large population groups by making everyday foods more nutritious, complementing other efforts to diversify diets. UNICEF supports mandatory large-scale food fortification of foods for children and women, including complementary foods. Large-scale food fortification requires a systems approach with the food system as a major entry point. Persistent gaps in critical data impedes program implementation. Many countries lack critical data and information or are insufficiently using available data on the industry structure, food supply chains, compliance, coverage, food intake, and nutritional status. Such data issues impede program design, oversight, and evaluation. Data quality, frequency, utility, and analysis needs to be prioritized to create efficient large-scale food fortification programs in the region. Fortified foods must be sustained through effective internal and external quality assurance and effective regulatory and monitoring systems. Innovations to support solutions such as technology can help make monitoring simpler in the region. Strengthening food fortification efforts across South Asia, very important for addressing nutrient gaps for children and women. It is also equally important to close the gaps in monitoring of food fortification interventions and programs, regular assessment of the quality of implementation, the micronutrient needs of the population, and their consumption patterns of fortifiable foods are essential part of monitoring a fortification program throughout its program lifecycle. Today, we need a food system that works in tandem with the health and social protection system to deliver nutritious, safe, and affordable diets. We need to unlock the full potential of large-scale food fortification in supporting nutrition improvement efforts in the region. Thank you so much, and wishing you a pleasant day.
Okay, thank you very much. And I think as a final remark, and this webinar addressed many topics by experts. And considering the escalation food prices in the globe, I think fortification of common food items are as a very promising future, especially to minimize the micronutrient deficiencies. And then because most of our countries, we have micronutrient deficiencies are the huge problem. And at the same time, whatever the programs we initiate and the monitoring of such programs are vital, as well as those are mandatory. And this is very much important to identify in that way how we can coordinate together, work together, and how can we really support the monitoring activities in countries. So I think all our speakers are really, I think they have really had given their all expert views, and you can always contact them. They will be there for you all. And at the same time, IGN has our country coordinators. You can always contact our country coordinators especially for this monitoring component. This is something very important for the countries to get to know, that when you have these all country coordinators for your support, as well as to coordinate and collaborate with all the agencies. I think this is very much important with the resource lack environments. All of us should really coordinate and work together, then we can really reach the common goal without much problem. At the same time, I would like to thank all the speakers and participants and our national coordinators. At the same time, I would like to thank Anand, especially. I think he was there from the beginning and he was really kind of answering all the questions in the chat box. All these presentations and the videos we will share as a folder, and we will email to you in your link. Then we can really meet for the next webinar in the future. Mainly we are trying to focus on what are the monitoring tools available, and how can we really support, how can we implement and integrate these monitoring tools in the countries. So everybody, I think, thank you very much. I hope that you have received answers to most of your questions from our experts. And Faiz, thank you for answering the questions meantime, and all the IG and our national coordinators. At the same time, I can see some other regional coordinators also, like Izzadin. Thank you very much for your participation, and all the participants. Without you, there won't be any webinars. So you are the most admirable group.